morning. I'm so glad to see everybody here today. This really is an exciting day for Henrico Area Mental Health and Developmental Services. It is my pleasure to welcome you to the opening of our beautiful new building. We have been planning and waiting for this day for a long, long time. With us today is John Vitokas, Henrico County Manager, and a Board of Supervisors, Mr. Nelson. We would not be standing here today without their unwavering support of our mission and our work. I'm extremely grateful for their commitment to ensure residents receive critical services that promote recovery, independence, and self-sufficiency. There are a few other people I'd like to acknowledge. We have members of our Community Services Board here. Thank you for being here, along with representatives from the Department of Behavioral Health and Developmental Services, including Mara Signer, who is the Chief Deputy Commissioner. We have members of our design and construction team in attendance, including Mosley Architects and Luff-Ridge Company Construction and General Services. We also have stakeholders, regional partners, new neighbors, other county departments, individuals who receive services, and the dedicated staff who day after day do amazing work. Now I'd like to invite John Vitokas, Henrico County Manager, to come forward and share a few remarks.
Thank you, Laura. Good morning, everyone. Good morning. So, I'm delighted to join our chairman, Mr. Tyrone Nelson from the Board of Supervisors, Dr. Jessica Brown, and our homegrown superstar, Ms. Laura Toddy, and each of you today in this ribbon-cutting ceremony as we commemorate the grand opening of this facility. I actually got lost with a group of employees just a few minutes ago. I was meandering through, and I apologize that we got started late. I was just enthralled with what I was seeing inside. We're thrilled to open yet another new, beautiful public facility in the eastern portion of our county, but we're more excited about the impact that this center will have on those who enter its doors. Here in our county, we're not focused on building bigger and better to garner attention. We're focused on building smart and responsively to meet the needs of both today's residents and those of the future. This new center, I certainly hope, does exactly that. As today's 1,100 clients will visit this facility each month, they will be invited inside by a trauma-informed design that brings the outside in. From color schemes to water features to lighting, every individual will feel welcome in this place. And in addition to being 14,000 square feet larger than the previous clinic, this new facility provides current and future clients with an expanded array of services. This facility will provide same-day access services, outpatient services, early intervention services, substance use disorder services, integrated primary health care, and the list goes on. As telehealth will also be available, clients will be served right here, in place, with no other stops to make, and what a great impact this will have on our community. And for the all-stars that will staff this facility, a facility is nothing without the staff that is in that facility. So I want to take a moment and thank each and every one of you for what you do on behalf of our community and the residents. Ladies and gentlemen, thank you so much for what you do. So I'd also be remiss if I didn't thank Laura Toddy and your team as you started through this project. This was quite the project. John Neal and his staff from General Services. The story is, when the initial estimates came back from the architects, we thought we had a project that was going to cost this much and the budget was this much. And thankfully, we tested the market and the market responded. To the general contractor, thank you for everything that you've done. And ultimately, we were able to, with the help of others like Dr. Brown, be able to bring this project into into compliance with our budgetary restrictions. And I want to say this to the employees because you need to know it. None of this would be possible without each of the 5 members of the Board of Supervisors, because everything that we do locally ultimately has to have the steadfast support and approval of the Board of Supervisors. And in this particular project, we had individual members of the board that not only expressed interest, but actually made suggestions regarding this project. So I want to take just a moment and thank you, Mr. Nelson, but I also want to thank those that couldn't be here because of scheduling. And I want to thank personally Mr. Thornton, Mr. Brannon, Mrs. O'Bannon, and Mr. Schmidt for their help, because nothing, again, ladies and gentlemen, we have a lot of great things happening in our county. None of that is possible without the elected leadership of our county. So without further ado, our chairman, Mr. Tyrone Nelson.
Good morning. I had a 30-minute speech prepared. And being that it's 100 degrees outside, I'll try to cut it down. Thank you, Mr. Manager, Ms. Toddy, and all that are involved, Dr. Brown, in making today possible. I am excited about this Henrico Area Mental Health and Developmental Services building, our new East Center, right here on 9 Mile Road. A little more than a month ago, many of us were here. We're not here, but just up the road as we gathered to cut the ribbon for the new Henrico Aquatic Center. And that facility, too, promises to bring new services and opportunities to a part of our community that hadn't always had access to it. This morning, we are gathering again to celebrate another significant investment in our community. The new East Center represents Henrico's continuing commitment to enhance and expand services for all of our residents in the county. In this case, that also includes residents of Charles City and New Kent counties as well. This is an impressive building behind me. It has a state-of-the-art telecommunications, a medical unit, a pharmacy, among other special features. It is designed to serve clients efficiently in a welcoming atmosphere. It is built with energy, it is built to be, energy efficient and environmentally friendly. But the true measure of this building is found in the way it supports and serves the people who use it. This building does just that. The new East Center will enable our staff to further enhance the vital, comprehensive services they already provide to adults and children in Henrico, Charles City, and New Kent counties. It is designed to accommodate future growth as Eastern Henrico's population grows. It also will give the staff here the freedom to be innovative and pursue more opportunities to serve their clients. I know that staff is excited about the possibilities represented by this new facility, and I wish them the very best as they continue to do the good work that they do. Now I'd like to invite my friend, Dr. Jessica Brown, Chairperson of the Henrico Area Mental Health and Developmental Services Board, also a proud Varina resident, to come forward and share some remarks. Dr. Brown.
Good morning. I want to thank Reverend Nelson and Mr. Vitolkis and my friend and colleague, Ms. Toddy, for this opportunity. Today is an exciting, exciting day. As chair of the Board of Henrico Area Mental Health and Developmental Services Board and the Varina District Representative, I speak for each and every board member when I say how excited we are to present this building to the residents of Eastern Henrico. The intentionality and care with which this building was planned affirms the deep commitment that the staff of this agency and the officials of our county have to the residents of Henrico, New Kent, and Charles City counties. Every day in news headlines, we hear about addictions, about substance abuse, about rising instances of mental health diagnoses, about increasing stressors that threaten our ability to live happy and healthy lives. As a licensed clinical psychologist, I know firsthand the greatness of the need in our community and in communities around this country. And this means that the work that mental health professionals do in all of our many forms is incredibly important. This agency has a proven track record of providing evidence-based care that addresses the needs of the community, from integrative grant-funded programming to same-day access that allows people to begin the treatment process as soon as possible. Henrico Mental Health represents excellence and is a leading community service board in our state. The opening of this new East Center allows the building to adequately represent the people who work so hard inside it. It sends a clear message to the surrounding area. Henrico County is committed to being on the cutting edge of providing quality mental health services in a bright and engaging environment, accessible to as many people as possible. As board members, we are excited to affirm this excellent work, this excellent agency, and we want to convey our deep appreciation to county officials and to the Board of Supervisors for their commitment to this work and to this community. Thank you.
So we are here to cut the ribbon, so let's do it.
Do we have anyone else from the board, from your board?
Just stay on.
Just stay on, okay. All right, Laura, call it.
So our building is open. Please come in, and we have folks that will take you around and show you. We'd like to show it off. I would like to say we have only been here since Monday. We moved last Friday. Staff came in the building at 12 noon and unpacked, and by the end of the day Friday, we're ready to go. So you'll still see some boxes. You won't see all the pictures on the wall, but we are open for business. So come on in. Thank you.